Hello everyone, Nav Ahluwalia, the Medical Director of Ardash, and I'm also the Director of Research, and today it's the Director of Research hat that I'm wearing, which I think is more important. Because I'd like to talk to you about a study that the Trust is involved in, a very exciting study called the COPCOV study. Now that sounds like a bit of a mouthful, but it's a way of us trying to see if there's a new way of helping to manage coronavirus. So there's four things I'd like to talk to you about. First of all, what is COPCOV and what is the medication we're thinking about trialling? Second, who can take part in this? Thirdly, why do we need to have this one involved when we're already talking about vaccines? And finally, why might this be something that we should always consider for future cases of viruses that might from time to time spread around the globe? So let me tell you a little bit about some of those issues. Start with the medication itself and COPCOV. The first thing is that everyone can take part in this study, not just those who are frontline NHS workers. Anyone can take part in it. So you might be thinking, well, what's this medication now? Well, it's called hydroxychloroquine or chloroquine. Now, you may not have heard of that, but it's a malaria treatment, and therefore it's been around 50 years, tried and tested at higher doses actually in malaria treatment. But in low doses, it's been found to be potentially antiviral. And we know that COVID-19 is coronavirus, it's a virus. So we think that this is a very important line for us to consider a treatment intervention. That's the use of hydroxychloroquine to see if it can manage the coronavirus. You might be then thinking, well, haven't we got a vaccine now, Nav? Well, yes, absolutely. There are lots of vaccines that are being trialled around the world. So far, there appear to be 3 that have published interim results. The thing I would urge you to think about here, though, is, first of all, when we do have a virus, we don't know how long those antibodies will last for to offer us that degree of protection against coronavirus. Second, not everyone can take the vaccine or will want to take the vaccine for personal reasons. And thirdly, there are times when you will look at a priority list for who should get the vaccine. And at the moment, it appears that the priority list appears to be healthcare staff, social care staff, and the very elderly. So it might be that there are some groups that don't get the vaccine till much further on down the line. What does the study involve? Well, it involves a number of individuals getting together for the study. Then half of that group will get the hydroxychloroquine, and half will get a placebo, which is a tablet that looks just like the real thing, but actually is not a medication at all. And the 2 groups will be randomized. So you won't know whether you're in the treatment arm or the placebo arm, nor will any of us. And then that's done for 3 months. And at the end, we'll see if that's made a difference in terms of people getting coronavirus, or if they do get it, have they got it in a less severe form? So what does it involve? It involves very few things, actually, just monitoring your temperature and logging how you feel every day. Checks at 1 month into the study, 2 months, and finally at 3 months, and a small blood test as well. So it's not very onerous. The other thing I think that we should think about is that this drug might actually have a role in future pandemics. So although the vaccine is being prepared for this pandemic, if we look at this medication and it is found to be useful, it could be that in 5 or 10 years' time, if there is another pandemic, we already have a treatment option available to us before we have to start looking at new vaccine developments. And I think that's really important. So it can help not just for the current pandemic, but also future ones. If you do start on this study and you do want to then have the vaccine, not a problem. So I hope you'll consider this study. I'm certainly going to be involved in it, because I think I want to not just see if it's a medication that will help me and my family, but also my NHS family and the population that we all are part of and hope to serve. And I'm also hopeful that it will help us think about whether this can help not just in supporting the population to have another thing to help them with the virus apart from the vaccine, but also those who are involved in future management of pandemics, both in this country and around the world. Thank you very much. Take care.